Great. So we're giving everybody a moment here to settle in. Thank you all for joining. And I just wanted to take a moment and introduce myself. Thank you all so much for being here with us today. My name is Kabir Ali, and I've had the pleasure of working alongside Dr. Houman over these past 8 months. And it's really just been a wonderful experience and an honor, really, to see our program grow and evolve. And a big part of that journey has been creating the space for these conversations, like the one that we're about to have today. And these webinars actually are a core part of our mission to bring people together, share insights, and create a supportive community. And I'm grateful to be here with each and every one of you. Um, Lisa, connecting with you over these past few months and welcoming you to the practice and our community has been a powerful experience. I think that's the right word to use. And both your expertise, your energy has just been so valuable. So thank you so much for being here and participating in this conversation. So it's just great to have you. And with that, I think I'd like to hand over the mic over to you, Lisa. And if you could just introduce yourself, share your story, your background, whatever you're called to share. I know the group would just, love to hear from you. And then Dr. Human, after that, perhaps you could also introduce yourself and share the vision for the practice and just the work that we do here. And if it seemed like I was reading this entire introduction, I was. So over to you, Lisa. Thank you.
Thank you so much for that beautiful introduction. And it gives me great joy to be here with all of you, sharing on this beautiful topic. So just a few words about me. So I'm a licensed clinical social worker in private practice in Los Angeles, and also a longtime practitioner of Vipassana Buddhist meditation, and a teacher here with Inside LA primarily for over the past, I would say about 15 years, which sounds like a long time. But it's been an incredible experience, kind of blending clinical understanding with Buddhist wisdom, especially at this time on the planet. So I teach all kinds of classes: mindful self-compassion, mindfulness-based stress reduction. And also what's been a beautiful outpouring of my Buddhist path practice has been a real turn towards impermanence and end of life issues. I'm a certified death doula, and I feel so grateful to have had the experience at UCLA over the past 10, 12 years, I guess, at the Simsman Center for Integrative Oncology. I was a mindfulness therapist there for a weekly group for a very long time, and also worked with cancer patients, people touched by cancer, at the cancer support community here in Santa Monica. So my work with people at end of life has really been a profound impact on my work, my focus as a death doula. And that's why I'm so glad that today, this webinar, there's a focus on end of life, palliative care. It's, and maybe I'll let Dr. Houman introduce himself as well. Maybe we can both share a little personal history about what brought us to this. I don't want to say too much right away. I'll also say that also what's been a recent development, really exciting, is that I've been very fortunate to move into the field of psychedelic-assisted therapy. I recently graduated from the California Institute for Integral Studies, their certification program for psychedelic-assisted therapy and research, and am trained in ketamine-assisted therapy with Polaris Institute, or Polaris Insight Center. So it has brought me to Mystic Health and Houman. And so it gives me great joy that all of these threads, Buddhist practice, mindfulness, end of life, as well as, this really emerging field of psychedelic-assisted therapy, kind of, I feel like I'm poised, very fortunately, to kind of weave these things together in as skillful way as possible. So I really welcome this discussion. And I want to kind of hand it over to Houman so that he can say a few words, and maybe we can both talk a little bit about more about what brought us into, at least for me, what brought me into meditative practice. It does link together a bit, but I want to give you a chance to speak as well.
Thanks for that, Lisa. Yeah. So, first of all, it's amazing to have you. Having someone with your degree of expertise and background in this is something I really value and cherish. So, Mystic Health is a vision that's been a few years in the making, launching this at this time as my private practice in Los Angeles. And this is a practice that is psychotherapy focused, and the framework of psychotherapy that I've wanted to bring to this is really mindfulness based. So having you as part of the team is really valuable to me. And the offering that we have is an offering that really can be applied to, a large percentage of the population. It's really my vision for the offering is not necessarily for those of us that are most ill or approaching end of life, but it happens to be that in my professional development, I've had this affinity, and my path has led me to focus a lot of my work on the palliative care population, which are individuals that are dealing with a life-threatening illness and their families. And so a lot of our offering does have this sort of niche specialty of bringing together concepts of mindfulness as aided by psychedelic therapies and offering it to patients and families that are dealing with more existential challenges. That being said, I think a lot of the population does deal with these existential challenges, and the wisdom that can be applied to this patient population really applies to everyone. I personally got interested in psychedelic-assisted therapies from a medical angle once I learned about the link between mindfulness and psychedelics. I was fortunate to be introduced to meditation and mindfulness type practices through my family at a pretty young age. So as a teenager, I got this exposure. And when I was in college at UC Berkeley, I remember taking this course that really taught me a lot about the neuroscience of altered states of consciousness and how using functional MRI imaging, you can see how similar parts of the brain are active in, let's say, Buddhist monks with decades of experience meditating and users of psychedelics. And so that's a scientific link, as well as the experiential aspect that I always strived to experience, has led to the sort of synchronicity of these two fields and how one can be used to enhance the other one. And we can talk a little bit about the research later on as well. But, part of my own healing journey, my evolution, as an individual has been integrated with mindfulness practices. And you mentioned Vipassana. My experience doing a Vipassana retreat, I think about 6 years ago, when I went for my first and only 10-day retreat doing Vipassana, that was where I really got to tune in, to my deep wound of losing my mother, using just like, pure Buddhist guided meditation and the Vipassana method, and sort of working on that mind-body link, really, the idea of the trauma being stored in the body. And by being embodied, I was able to tap into some emotion that had been stored deep within me. So I really believe in the power of this work, and feel really fortunate to be able to offer this to our patient population as we launch this practice. And I think with that, I'd love to pass it to you to perhaps talk a little bit about your personal experience with that, and even after that, speak maybe about what is mindfulness, more broadly speaking.
Yeah, thank you. It's interesting for me because I always find it beautiful to explore with other people how they found the practice. Um, and for me, what's interesting, it really links to end of life. There's an irony there, is that for whatever reason, when I was very young, starting when I was young, I was acutely aware that nothing lasts. And while I didn't experience a death early in life, I didn't, which is interesting to me. I felt this really kind of acute anxiety, a kind of existential angst that was just always there, kind of an undercurrent of anxiety that plagued me from a young age. And I did not know how to work with it. I was surrounded, my family, I did not grow up with meditative practices. And so I didn't have any tools to work with the truth of impermanence. And for whatever reason, it was just very much alive in my awareness. And, I soldiered through life. I really kind of managed this as best as I could. I felt often that I was white knuckling it. That was the feeling that I had. And I had just a undercurrent of anxiety, and it kind of propelled me into being very productive. I guess you could say that was the way I coped with it at the time. Um, I wanted to do work in healing, got my master's in social work at a young age and started working. But I just really didn't know how to be with this. And as I matured and as my life took shape, I got married, I had young children. And what happened was for me is that the more I had, it became more acute, this anxiety, because the more I had, the more I was hyper aware or acutely aware of how much I had to lose. It almost as if having love in my life, what came with it was the specter of loss. It just came with it. And I could feel that as true. And I had a really hard time coping with it. I did try to find, I always yearned to have a meditative spiritual path. And I did try a couple different lineages, but it didn't quite stick for me. So what was very fortunate for me was that, our children were young. I was a stay-at-home mom for the first time with young babies, and I was really overwhelmed with anxiety and with angst. And I think if I could say it very, very simply, I could not just be. I could not just be as I was. I really justified my existence by what I did. That was my way of coping, by constantly doing and achieving. And, this was my way of coping with the anxiety. And I don't know if I really understood it deeply, of course. And so I was very lucky at this time. For me, it was a time of crisis and great acute suffering. Where I was lucky because in my master's program at USC, when I was getting my social work degree, I was really focused on attachment theory. And maybe you're familiar with Dr. Dan Siegel, who is one of the co-directors of MARC at UCLA. So I was really lucky because he focused on attachment theory and interpersonal neurobiology. So I was very lucky to get into a small clinical group with him at the time that he was meditating and writing books on mindfulness and the neuroscience of mindfulness. And it felt like a real stroke of fate for me and grace that I ended up in that small group and heard him talking about going to Spirit Rock, which is a place where many of us in this lineage go on meditation retreat, with Jack Kornfield and John Kabat-Zinn and Joseph Goldstein and such. And I immediately had this intuitive sense that that was the way for me. And I was very lucky because he was the co-director at the time of the Mindful Awareness Research Institute at UCLA. So I jumped in with both feet and both hands. And I was really lucky in that I think this more secular door was really the way that where the practice opened up deeply and fully for me. Although now, as the practice deepened, I'm now practicing more classical Buddhism, you know, in the way, maybe traditional Buddhism in the way that we understand it. But I was very lucky to find the practice then. And the path just opened up very quickly, very deeply right away. Um, I felt incredible benefits immediately. It was immediate. And I was lucky that I started training to be a mindfulness-based stress reduction teacher with John Kabat-Zinn when he was still teaching and all of that. So I guess for me, I really, it's ironic, you know, that I'm a death doula, isn't it? You know, here I was a person who was really plagued for years with existential angst, really plagued by it. And I think that for me, and maybe it dovetails into we could have a conversation now about what is mindfulness, what is this, right? And it really does come directly out of Buddhist practice. It's important to realize that sometimes it's extracted out of that very deep, wise spiritual path, but I think it's good to understand it within that context. But why it helped me so much was because for the first time, I had some tools, some really clear experiential tools of what it feels like, what it can be like to just be in the present moment, to be deeply aligned and present. And I guess maybe a working definition of mindfulness is this kind of, you know, in the suttas dating back to the Buddha, it's constantly referred to as knowing direct experience as it's happening, knowing, deeply knowing. And so it's good to unpack what this means, this knowing, because it's a deep, profound understanding and being with our experience in the present moment. It is a knowing of our present moment experience in the body, heart, mind, as it is happening, but it is knowing in a very particular way. It's knowing with wholesome mind, heart states, with curiosity, with a quality of welcome, responsiveness and care, and deep receptivity. So it is a very particular kind of knowing. For me, the antidote to my angst about loss, which is always in a future that never quite arrives, right? It's always this what if. I think what I was missing, what I didn't have the capacity for, was to be really deeply embodied in life. It was happening, and once I became comfortable and joined the flow of life, life itself was the antidote. Being deeply connected to life, it was happening, just calmed everything down, and it provided the balance that I really needed. I also like Joseph Goldstein, who is a teacher in my lineage of practice, Theravada, Vipassana Buddhism. I really like his definition because oftentimes there's this thinking, oh, it's just about being present, just be present, you know. But mindfulness in the way, in the really deep understanding as deep medicine, as healing, is it's not neutral. I don't think it's neutral. So that's why I really like his three components. He breaks it down so that there's more deep understanding and nuance to what this practice is. And first, it's this, and you said this when you went on retreat, you became embodied, right? You talked about becoming connected into your experience of the body. And that allowed you to connect to the truth of some of your suffering and your trauma, right? And so the first component is really establishing mind-body connection in the present moment. And I often say this, I use my hands as an example. The mind is often in one place and the body is somewhere else. And we often live in a disconnect. I would say I was living, before I found practice, in a kind of disconnect, mind-body disconnect. And within that disconnect, that's where a lot of anxiety, a lot of the chronic mental health problems we have, a lot of it really lives in this gap. And so it's essential, it's foundational that first there is this kind of reconnection, and that the mind and the body, there is a connection in the present moment. And this is essential, but it doesn't end there. It's important also, the second component is to also, that there is, it's called metacognition, but it sounds a little conceptual. It is this knowing awareness as it's happening. There's a kind of observing awareness of experience as it's happening. So there's that also. So there's mind-body connection, observing awareness as it's happening. And then the third component is very important, and that's that we're being present in this way, we're showing up in this way. There is this kind of quality of knowing while we're knowing, right? And then the third component is that we are really cultivating, in relationship to whatever is present, a wholesome quality in mind heart, in the present moment. We're really investigating and inquiring about how we are relating to what is present. There is why this is so important, I'll kind of ground it in about liberation from suffering, why it is so important to know how we're relating to what is present, is this kind of insight that is kind of core to mindfulness when we start to land into it. And that is that it's not what's happening that is determining our experience. It's not what's happening. We're often so caught up in the content of the external conditions. It's not so much that. It is actually, the big insight is that it's how we're relating to it, responding to whatever is arising in the body, heart, mind in any moment, that actually determines whether the experience is one that that leads to well-being, to freedom, or to perhaps continued suffering. There is a beautiful quote by Ajahn Chah. He's a Thai forest, Thai master in Buddhist tradition. He has a wonderful quote that kind of points to this. He says, there are two kinds of suffering. There is suffering that leads to more suffering. And then there's another kind of suffering that leads to the liberation of suffering. And you feel the difference here. It's that with mindfulness present, if we can relate, if we can cultivate wholesome mind-heart states to whatever is arising in our present moment experience, that it will really transform that moment from suffering into liberation, into transformation, into healing. And this is why mindfulness becomes this very important ingredient to how we suffer less in our lives as it is happening. So I find this to be really, really important to note. I'd love to sit back a little bit. We can talk about how this looks in terms of practice, right? How do we practice mindfulness? There's so many different ways, because we can bring it to every area of our lives in any moment. This is its power. And we can meet any moment in this mind, body, knowing awareness, and then respond versus react, to know the difference and to feel what unfolds when we can cultivate in relationship, even to deep suffering, that we can meet it with love, with compassion, um, with wisdom. And it really does transform our experience so we don't become further mired in it. We become free. We learn, we grow from the experience. So I do want to hand it, I would love for Houman to maybe add to anything I've said, and if this resonates for you.
Thank you. Thanks for all of that. There's so much wisdom in there, and you said so many important things. I think you really put well how this practice can essentially lead to less suffering. You know, one of the goals of our offering is to reduce suffering, is to facilitate healing despite the, let's say, lack of ability to cure a condition, or despite the lack of ability to change the course of illness for a loved one. And so part of that, is to sort of deal with what is happening in a different way. And I think it's really important as an approach that we can use, both as someone who is actively dealing with an illness, or as an active caregiver in that sort of picture, but also to apply it to a healthcare provider or a clinician. And I know that some of the members in our audience are actually healthcare providers. And I think all these things you mentioned apply equally for us providing care, to be able to provide it in the best way possible, to prevent empathy fatigue, to maintain a compassionate approach to care, which becomes really hard to do in a healthcare system that is stressed. And many people don't have the privilege of getting access to a lot of the help they need. But a lot of the things that you mentioned are things that we discuss in a course that I'm fortunate to be part of the faculty of, and that is a mindful medical practice course that we teach at McGill to all medical students. And that is really taken from the teachings presented by the MBSR type courses and the training that you've had. And one of the definitions used for mindfulness in that approach is this non-judgmental moment-to-moment awareness. And I think, that's one of the ways that we can perhaps expand on this definition. Really, when we do work on our own psyche, one of the things that we can realize is that our judgment towards, let's say, other people or situations often has to do with elements in our own conscious or subconscious material. And so, one of the goals in practicing this mindful awareness is trying to maintain that non-judgmental awareness. And that doesn't mean to rule out the value of judging. I mean, the mind is here to judge and to help us survive, and to help us remain functional. But it's more about what you said, which is, rather than having these triggered reactions to events that have a particular impact on us, we can have a pause and a response. And that response could take into consideration not just sort of the external factors, but also the internal factors that affect us and the context. And so altogether, having a congruent response rather than a fragmented response that is more in the form of a triggered reaction rather than a mindful response. And so with that sort of approach, we can perhaps maintain the compassion. And that's one of the things I really liked about what you said, is maintaining that connection with the heart. I think that connection with the heart is something that's really interesting. and something that requires cultivation, that emphasis on maintaining that compassionate, let's say, unconditionally positive regard is something that's really important in this mindful practice, and something that we emphasize in psychedelic therapy. So I've also been fortunate to be involved with training of healthcare practitioners that want to do psychedelic therapy. And I think this is a good segue into that. Having these mindfulness practices, as someone who's providing psychedelic therapy is extremely important. I think in any sort of caregiving capacity, but with psychedelics being the powerful tools they are, it becomes really important for us to maintain our presence, and this idea of co-creating an experience with a patient, and the fact that our state of presence is going to directly impact the nature of the experience, I think is really interesting. And I would love if you can perhaps touch on that.
Yeah, thank you. I agree. I think that well, there's a couple wonderful ways to explore how mindfulness supports psychedelic-assisted therapy. Not only is there so much synergy overall, but it really resources the therapist or the MD in the way that you've described. So maybe we can go into that a little bit more. And also, it deeply prepares and resources the set for the participant and establishes a relational field that allows for healing between, the MD or the therapist and the participant. I want to say that to me, what's really exciting about blending mindfulness-based kinds of training into psychedelic-assisted therapy, and of course, this assumes that the therapist has some training in this. So it's good you're doing the training, because I think that it's so important that the therapist is resourced in this for the following reasons. The synergy that is so exciting about psychedelic-assisted therapy and mindfulness is that they are both essentially subjective, non-conceptual, experiential, and present moment focused modalities. They really are, right? And a lot of therapeutic models that are existing, and you see a lot of other people in this new emerging field of psychedelic-assisted therapy, there does need to be this therapeutic piece. And so right now you see people that are experimenting with different therapeutic models and how they best fit with psychedelics as a therapeutic model. And I find mindfulness to be really very powerful and effective because it is not conceptual. It is profoundly experiential and open and receptive. And it doesn't, other therapeutic models tend to have a conceptual frame that can override or interfere with the process as it's unfolding in real time, either in any phase of the psychedelic-assisted therapy, preparation, of course, the journey, and in integration, right? And I love the way that you said that between the therapist and the participant, it is so beautiful that this is collaborative process, that there's not a top-down kind of where the therapist is the expert, right? The therapist is there to hold really beautiful protective space, to create that, to help hold that. But the therapist is not there. If there's too much of a conceptual frame, there always is going to be where the therapist is the expert who might have an agenda for what's good for you. Do you know what I mean? What I'm saying by that, right? So with psychedelic assisted therapy, the conceptual frame is really kind of being removed for all the best reasons. It's removed also in mindfulness and in Buddhist practice. That's where the healing is, when the conditioned mind is bypassed through meditative practices, or, as we say, the default mode network gets deactivated. Maybe we can talk a little bit about that. There's a lot of synergy in that. So a therapist who is really resourced, and this is important to note, who is really resourced and in fact embodied in mindfulness-based practices or Buddhist path practices, really, and these practices go from something that you practice to what you become, which is so beautiful, right? So there is embodied presence. And that is what seems to be so beautiful and important in establishing a really beautiful therapeutic relationship that's trusting and safe. Because the therapist is really embodying these qualities that you kind of named, these qualities of compassion. There's a real understanding of this. And it's a very powerful quality that resources not only the therapist, but the participant. It's a both and. There's a non-dual aspect to that, these practices, right? It's a both and. And kindness, just metta, as we know, is just this really beautiful, like the sun in the sky, just shining unconditionally within the experience. It allows, in that non-judgmental way, it allows all material. I think that the unconscious is always listening. It's always listening, right? And so it contacts the whole field. Metta, these kindness, these practices, they really do contact the whole field within the therapist and the participant, so that there can be a field of wholesome, it's a wholesome container. The other thing that I think is not talked about, and I'd love to hear from you on this, I feel like it needs to be talked about more, is that when we do move into psychedelic-assisted therapy, both in meditative practices and also through psychedelics, we are opening into non-ordinary states of consciousness, right? We're really expanding, often into transpersonal states. It's really expanding into really deep states of consciousness. What's important about creating a container when this is taking place, this also is true for meditative traditions, is that there needs to be protection. This space needs to be protected and guarded by wholesome qualities without any kind of competing agendas. And what's so beautiful about mindfulness practices, this embodied, wholesome, remember, we're relating through mindfulness, through these practices, we are embodying and relating to whatever is present in a really wholesome, responsive, non-reactive, kind way. And it creates a field of protection for both the participant and for the therapist. The therapist can self-regulate through these practices in real time. There's bound to be material that may surface or emerge. The therapist has to be able to, independent of the participant, has to have their own tools to self-regulate any, of course, there's going to be perhaps some reactivity. You have to self-regulate independent of the participant, and you have to hold yourself with your own self-compassion, right? That has to be there. And also really have that knowing awareness, that second component of any countertransference issues that may, emerge. They do, right? And so all of this creates a really, I guess what I'm trying to say is that what's important to healing and psychedelic-assisted therapy is a really wholesome setting. We talk about set and setting as being key, important factors, optimal set and setting within psychedelic-assisted therapy. I can't say enough about how important mindfulness and these practices of embodiment establish this as a relational field, and that this is very important, that there be a wholesome field. Psychedelics are often referred to as nonspecific amplifiers. If they are nonspecific, which is why set and setting is so important. What is being amplified is what is present, right? What is showing up. If there is a wholesome capacity to hold this. And, as a therapist, as an integrative therapist, what's so beautiful is I am holding like a midwife. I'm really holding really wholesome and embodying wholesome qualities within the field, right? So that whatever material does emerge, it is able to, I'm not in the way, right? And it's wholesome. And so I don't know if this is talked about enough. Metta, which is kindness, one of these wholesome qualities that we do cultivate as a Buddhist practitioner. Dating back to the Buddha, I love this. It's really thought of as protection. And so when we're opening into transpersonal states, we are really opening into really profound. We're allowing consciousness to really expand, right? And allowing perhaps like on your retreat material that may be painful to emerge, that it be held within a wholesome, kind, compassionate field is I think really essential. And what the therapist can impart, transmit, and train the participant in is to help them really cultivate an optimal mental mind-heart set that will also create a wholesome, non-specific amplifiers. The set of the participant really has a big impact on where it's going to go, right? So if there is this wholesome set that is cultivated with the participant, also being held by the therapist, this is a beautiful, important, I think, essential aspect for the psychedelic-assisted therapy, for it to unfold in the most wholesome way for healing and transformation as possible, also ensuring safety and protection. So I'd love to hear from you about some of that. I'm obviously very passionate about it, that there be an ethical container of non-harming.
Thank you. Yeah, there's so much to touch upon. Often, especially when we're doing psychedelic therapy with longer acting substances like psilocybin or MDMA, these sessions are 6 to 8 hours long. And it's quite challenging to sit for that long in a non-distracted state, not playing on our phone or reading or doing work, but really sitting with the patient. I think that's where that practice of mindfulness for the therapists and the healthcare providers is important. With ketamine, obviously, they're shorter sessions, so a little easier to do. But it's so important that, we're aware of our state with the patient and able to maintain that groundedness throughout potentially difficult parts of a journey. I think what you said is important. We have to sort of trust in the experience. We have to maintain this grounded force, and also be aware of what we cannot control. And so part of what we talk about in psychedelic assisted therapy is this notion of inner healing intelligence, or however else you want to define that. But a lot of what we do is allow what needs to happen to happen. I think you alluded to that. It's a different framework of healing, in that we're empowering the patient and trusting in their inner directed process. And like you said, really holding the space that would allow them to connect to themselves, to allow, what needs to come up to come up. And, if something dark and difficult is coming up, ultimately, we're the ones that could help them navigate through that safely. And I think that's one of the things that is really important to many individuals that are seeking this therapy is, what if I have a bad trip? And so talking about this notion of a bad trip The way I like to look at it now is that this bad trip is a challenging situation that isn't dealt with in the best way. And I really view mindfulness practices as one of the best tools to prepare us to deal with challenging content that could emerge in these sessions. And like you said, us maintaining our state of compassion and peace and trust, that is ultimately what's going to help the patient, reconnect to their own inner healing intelligence and to learn what they need to learn from what their psyche has revealed to them. Talking about this other definition of psychedelics as being, let's say, like a microscope for our psyche.
Mm.
uh, we get to see things that we don't normally have access to, and it's our response to that that could make that a healing, beneficial experience versus something that could re-traumatize an individual. And yeah, so that's what comes to me.
Yeah, I think there's a lot of synergy in mindfulness and psychedelic-assisted therapy in the way that you're describing, because I think both hold a kind of non-pathologizing lens, which is really, really important. Psychedelic-assisted therapy, it's often, like you were saying, referred to as inner healing intelligence. And from a Buddhist perspective, it'd be called inner nature, right? True nature, true nature. And there is this trust that often it's just there might be there might be things that get in the way, such as the conditioned mind, right? And so what we're doing through mindfulness and through psychedelic assisted therapy is we are kind of deactivating both of them. There's synergy also there, where we're deactivating what's called the default mode network from a neurological perspective, and that is really kind of bypassing and deactivating that activity in the mind that can really get in the way, that's really focused on creating our separate sense of self, constantly constructing that, really focusing on the future threats, past ruminations. It's nothing to do with the present moment, right? And both mindfulness and psychedelic assisted therapies, they both are shown to deactivate this tendency in the mind to be focused on anywhere but the present and all about me, the story of me, right? So it kind of allows for that to clear a bit, and for the inner healing intelligence, or for the true nature, to be revealed, to operate, I guess you could say. And mindfulness training, like you're saying, these bad trips, there are some people that have experiences. I do want to honor that have experiences that they feel are not meaningful. Often with the continued therapeutic alliance, there can be understandings around that, but if there is good training, good mind heart training for optimal set, it is my sense that there's enough knowing awareness that can be there while it's happening to navigate it, right? And the therapist is there to do that as well, to be with it for the first time. Some of these conditioned states that create so much of our suffering, that we can be with this. We've been running from it, been pushing away, judgmental of it. It's been neglected, it's been exiled, right? Banished from consciousness. It comes back, and when we are able to turn towards it mindfully, it transforms into kind of a really innocent hurt and a part that needs love and attention. And so it is, I love that, the Rumi quote, it's not so much, the task is not so much to find love, but to really dissolve all that's been built up against it. And so there is a little bit of that process, I think, with the right kind of support and therapeutic preparation. I think the person is resourced with some understanding and some tools. Once again, it comes back to mindfulness of how to be with painful material in a way, in a different kind of way, in a responsive way. And then the inner healing intelligence, the true nature, can start to operate in such a way. So I agree, and it's different case to case, but I think there's something very powerful about that non-pathologizing lens that we can hold to trust the process.
Thank you for sure. I mean, one of the things that we see often emerging organically is the notion of love being this binding force of all existence. And so in a lot of these psychedelic experiences, it just naturally arises once we're able to pass through some of that difficult content that emerges. And that makes me think of that notion of mic mindfulness
Mm,
and sort of the idea of mindfulness now being used as a tool to enhance performance,
mm,
whether that's to enhance performance, let's say as someone who is being trained to kill effectively, let's say in the military. And I think that just takes me back to that initial point you brought up, that having the elements of ethics and having the elements of the heart being involved in mindfulness is something that is important. Because if we think about these tools, whether it's psychedelics or mindfulness, as non-specific amplifiers, they can technically be used to do harm.
mhm.
And so, yeah, I think it's really important to have a framework that has that element of compassion, of you know, respect, and wanting to do no harm embedded, which I think was sort of designed in Buddhism from the beginning, but in some of the practices now it's been removed.
Yeah, you know what's so interesting as I'm listening to you, I completely understand what you're saying. It's a kind of a spiritual bypass, and it's not, it's the extraction of mindfulness out of the deeper path. Um, there is something really beautiful about psychedelics, and combining mindfulness, Buddhist practice with psychedelics, because I think what it offers is it does kind of center it back into a spiritual path that kind of brings it back. Do you know what I mean? It brings it back into this path for, you know, experiences of enlightenment, truly. You know, when this kind of unified experience of love that you're describing, that many, many people get in touch with, that also happens through meditative practice, Buddhist practice on retreats. It's very common that the heart find that the mind heart finds itself, you know, and knows itself. And so I think it's really interesting the way the psychedelics also bring mindfulness back into that deeper path, right? Bring it more deeper into that alignment, that there is no bypassing, you know, in your journey, whatever needs love is going to show up, right?
Yeah.
It's going to show up. So yeah, I think it's beautiful the way these things are kind of uh you know, supporting each other in the way when these things come together. I think it's really beautiful.
Yeah. You brought up these heightened states, and so the name of the practice is mystic health, and the mystical experience is something that you know, many people can have while on psychedelics or through these meditative practices, or sometimes spontaneously. You know, it's not that it's all about the mystical experience, but for me, it's more about, you know, how much of an experience like that can be incorporated into our daily life, such that the way we deal with adversity, the way we deal with ourselves and with our community, are in a way that's aligned with the essence of that experience, meaning, you know, again, having that compassion, having a non-judgmental awareness. And with that, I just want to bring up the study I just found
Mhm.
that was published a month ago, where a group out of Switzerland essentially did an experiment with 40 experienced meditators, and they randomized them to receive this mix of DMT and harmine, which is something like what ayahuasca is. And, they found that the individuals who did have the psychedelic substance added, they did have greater levels of mystical experience and emotional breakthrough. And, overall, it added to meaningfulness, and it had a spiritual significance and enhancing well-being in these individuals.
Yeah, and I'm sure it also catalyzes meditative practice. Like you say, it's good that this be integrated, like talk about integration, right? After these experiences. It shouldn't be, there should be, it's one thing to have a spiritual experience, but it's another thing to have a spiritual life. And so it goes from state to trait when sometimes these psychedelic experiences really for the first time help people understand why meditation, why we should, what it's about. And so it can really open it up. And so they both really, really feed each other and support each other that way.
Yeah, thanks. Yeah, the state to traits is something that we talk about, and having a fertile ground before going into, let's say, psychedelic experience, really can enhance the outcome of that experience, and allow us to maximize the gains from these practices. I know that we're close to the end. I don't know if, Kabir, there are any questions that came up that we should be answering.
No, there weren't any questions, but I've shared in the chat if anybody would like to go ahead and connect with us or any one of our clinicians, you're more than welcome to reach out to us at the contact information provided. But
Thanks,
no
Kabir.
questions at this time. No, thank you. Thank you. What a wonderful discussion. Really enjoyed each and every moment of it. Thank you both. And thank you to everyone who joined today.
Thanks. Lisa, as we wrap up, I wonder if you have any advice on people that perhaps want to start incorporating mindfulness practices into their lives, whether clinicians or patients. Um, any sort of starting point or any books that you would recommend?
Mm. Well, I recommend that people find a group and a teacher. Books are great, but once again, this is experiential, as I was saying. It's in real time. It's really helpful to practice with other people. It really is nice to have a group experience. We're very individualistic in the way that we live in our culture, and it creates a lot of suffering as well. There's a lot of division and isolation, as we know. It really helps people. And I teach it inside LA. Inside LA, we have a lot of courses that are on Zoom. So even if you live outside of Los Angeles, we have so many options. I'm teaching tonight at Hollywood Forever Cemetery. We have a Monday night every week. And I must say, it's an amazing experience when everybody comes every week. And there's something about shared bodies and talking and sharing and normalizing everyone's experience that starts to help people land into the practice, right? So I would highly recommend finding maybe online or wherever you live to Google and to see if you can find a group so that you're not alone with the practice. In my experience, it really opens up when you find community and a good teacher, of course, somebody who's embodied, somebody who's been practicing for a while and has some understanding, some wisdom, and some love. So those are my 2 cents.
Thank you. Thank you, Lisa. It's really helpful. I look forward to evolving, these principles, incorporating them into our practice. And one of my goals for this practice is to have some content to help patients prepare for the experience, to integrate the experience. And I look forward on working with you to create some of that. And thanks again for all that you've brought to us.
Thank you.
Great. So I think with that, I want to thank everyone who joined us, and we'll have a copy of this on our YouTube so that it can be referred back to.
Thank you. Thank you, everyone.